Okay, so before I enter the room, I'm gonna look at the patient's chart. I'm gonna look at their identifiers like their name, age, date of birth, and stuff, so that way I can know that they correctly identified it. I'm going to gather everything I need for the assessment, like my stethoscope, pen light, hammer, a cotton ball, and a tongue depressor. And now I'm gonna go ahead and enter the patient's room. I'm gonna knock, open, close the door for privacy. Introduce myself. Hi, my name is Hailey. I'm going to be your nurse today, okay? I'm going to go ahead and wash my hands, and I'm going to put on gloves. Okay. Can you go ahead and tell me your name, age, and date of birth?
Dee Birch, I'm 31, and January 25th, 1990.
Great, and can you tell me where you currently are?
The CSI Hospital.
Great. Patient is well-oriented, alert, conscious. She seems polite. She has good facial expressions. She's sitting up straight. She's breathing well. I don't see use of accessory muscles at all. Hygiene looks good. I don't smell any odd odors at all. Now, are you in any pain at all?
Nope.
Any allergies?
Nope.
Okay, I don't know any use of medical aids or medical equipment or oxygen with her. Do you use oxygen at home?
No.
No? Okay. Do you have any surgeries or any trauma that affect your respiration?
No.
No? And then, are there any religious beliefs I need to be aware of? No? Okay. I'm going to go ahead and get permission. Can I take your vitals now? Great. I'm going to go ahead and document vitals, and I'm going to look at her height and her weight and calculate her BMI while I do that too. Okay, do I have permission to continue on with the rest of the assessment?
Yes.
Okay. So we're going to be starting with your head. So I'm just going to go ahead and feel around and tell me if you have any tenderness at all.
Nope.
I don't feel any bumps at all. And when I'm looking at the scalp, I don't see any burns, any lesions, any infestations. The scalp color all looks really good. And now just coming in and looking at the skin all looks of good color. I don't see any jaundice, cyanosis, pallor at all. Okay, we're going to move on to your eyes now. So if you go ahead and just look at me, the eyelash and eyebrow hair distribution looks really good. The pupil and irises look about the same size. They look like they're aligned well. The sclera looks nice and white. I don't see any sagging or drooping of the eyes. I'm going to pull the bottom eyelids down, and the color looks really good for those. No sign of anemia, redness, any swelling at all or anything. I'm going to go ahead and take the pen light and just shine it in your eye quick. Okay, now look at this shoulder. Okay, pupil dilation looks really good for both eyes, and look at the eyes. I don't see any inflammation of the conjunctivae at all. No redness or inflammation for that. And now we're going to go into test your eyes, okay, with 6 spots. So follow my finger with only your eyes. Okay. Okay, eye movement all looks really well. Your eyes look really good. Okay, I'm going to go ahead and move on to your ears. Now looking at your ears, the ear placement looks good. The overall shape of both ears looks really good. I'm going to glance inside both of them. There's no discharge. I don't see any redness, any swelling within the ears at all. And I'm going to go ahead and test 2 points of your ear. Is there any tenderness at all with either of those? Any tenderness at all with that? No? Okay, ears look great. I'm going to have you close one ear and repeat back what I say. ABC. Now close the other ear.
XYZ.
Okay, good job. Your hearing seems to be really good. I'm going to go ahead and move on to your mouth. Now just looking at the lips right now, the lips look of good color, not chapped, no dryness at all. Okay, go ahead and smile. The teeth look really good, nice and white, look like they're cleaned regularly. The gums look really good. There's no redness or inflammation at all of the gums or around the teeth. I'm going to have you open your mouth and say, ah. Okay, look in your mouth, the throat looks good, uvula looks midline and center. You go ahead and close your mouth. The tonsils look good. I don't see any redness or discoloration or inflammation within the tonsils at all. The mucosal layer of your mouth overall looks of good color. No redness, inflammation at all. The tongue midline looks really good also. Okay, I'm going to go ahead now and feel you swallow. Okay, that feels really good, and we're going to move on to your neck now. before we move on to your neck, I'm going to check your nose first. Okay, looking at the nose, the septum looks lined up with the eyes and with the ears. Everything looks good about it. I'm going to go ahead and look inside. I don't see any discoloration inside, no nasal discharge. The mucosal layer looks really good, no inflammation. I'm going to have you close one side and breathe in and out. Close the other side. Did you feel like you could breathe easy through your nose?
Mm-hmm.
So it seemed like there's no obstructions within the nose at all now. That's really good. Okay. Put that on. Okay, now we're going to move down to your throat. Okay, I'm going to go ahead and feel here for your lymph nodes. Lymph nodes all feel good. The thyroid, I don't feel any swelling at all of the thyroid. That's really good. Now I'm going to have you move your neck and tell me if there's any tenderness. Look up, down, side, side. Any tenderness with that at all? No? Okay, good. I'm going to go ahead and have you take off your shirt now. Okay? And now I'm going to go ahead and feel your arms. The texture of the skin feels really good. They're warm, they're dry. Temperature seems even on both sides. Looking at the hands, there's no clubbing. Capillary refills within 2 seconds on both hands. The nails look really healthy. Okay, and looking at the overall skin, I don't see any jaundice, pallor, cyanosis. Skin looks really healthy. I'm going to pinch right here for tenting. I don't see any tenting at all, so you seem to be well hydrated. And now I'm going to go ahead and feel your anterior chest for any deformities at all. Anterior chest feels really good. Don't feel any deformities at all. I'm going to go posterior now, and I'm going to feel your chest again back here. That all feels good. Posterior, no deformities. And now looking at the spine, the curvature of the spine looks really good. The spine looks straight and aligned, and they're sitting with good posture. Okay, now I'm going to go ahead and listen to your respirations. There's 10 spots on both your front and back that I'm going to listen to. And every time you feel me move my stethoscope, go ahead and take a deep breath in. And when we're done with that, I'm going to percuss spots in the front and the back, okay?
Okay.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, that sounds good up front. I don't hear any wheezing, any crackling at all within the lungs. Now I'm going to percuss 5 spots up front, okay? 2, 3, 4, 5. Percussion sounded good and hollow. I don't know anything for concern at all. Now I'm going to move posterior, and I'm going to listen to 10 spots back here too. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. The lung sounds posterior all sound really well. Once again, no wheezing, crackling. All that I can hear, I'm going to go ahead and percuss 6 spots back here. 1, 2, 3, 4, 5, 6. All percussion sounded good, posterior and anteriorly. Okay, I'm going to go ahead and have you take in a big deep breath, let it out. Lung expansion looks really good. And now we're going to move on to your cardiac. So I'm going to feel your carotid arteries. The rate and rhythm of both feel strong and good. I'm going to feel your radial pulse. Radial pulse feels strong and good on both wrists, and your pedal pulse. Your pedal pulse feels really good on both feet. Okay, I'm going to go ahead and listen for any brutes on your what is the name of that? Of these arteries up here, carotid arteries, with the bell side of my stethoscope. Blood and pulse sound normal on both sides, so that's good. And now I'm going to go ahead and listen to the 5 points of your heart, and I'll say them when I'm listening to them. Okay. So aortic, pulmonic, ERB, tricuspid, and then apical or apex. Okay, the 5 points of the heart all sound really good. Okay, now we're going to go ahead and move on to your abdomen, okay? So if you can go ahead and lay down. Okay, now I'm going to look at the abdomen from 2 different angles here. The contour of the abdomen looks really good. I don't see any burns, lesions, wounds, ostomies at all, anything to be concerned with. Okay, now I'm going to go ahead and listen to the 4 quadrants of your abdomen, starting in the lower right. I'm going to listen for 1 minute each, okay? Bell sounds sound good in all 4 quadrants. Now I'm going to go ahead and percuss in all of them. Percussion sound good in all of them, and now I'm going to go ahead and touch all 4 quadrants in circular motion and tell me if there's any tenderness or pain associated with them. Nope. 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 Great. Now I'm going to go ahead and feel around your belly button. Tell me if there's any pain. Nope. No? Okay, I don't feel any bumps or anything to be concerned about within the abdominal quadrants, and feeling around the belly button, I didn't feel anything that could mean hernias at all, and just looking at the belly button, I don't see any hernias at all. I'm going to press right here, and now tell me if there's any pain. Nope. No? Okay, there's no kidney pain at all for the patient, which is really good. And now I'm going to listen to your abdominal aorta with the bell side of the stethoscope. Okay, your abdominal aorta sounds really good. Okay, I'm going to have you sit up and put your shirt back on. Okay, so now I'm going to go ahead and just feel your legs. The legs feel really good. I don't feel any edema at all within them. The color looks good. No jaundice, pallor, cyanosis, no burns, scars, lesions. Anything at all that I can see on them. Okay, now I'm going to go ahead and look at your feet. And looking at the feet, I don't see any clubbing at all. The capillary refill looks good on both feet. And looking at the heels, the heel color looks good on both of the feet. Overall, the feet look really good. I'm going to test your muscle strength now, so can you hold up one arm like this? I'm going to pull, don't let me. I'm going to push, don't let me. Same thing with this arm. Pull, push, pull, push with the legs, pull, and push. And now we're going to test your grip strength and squeeze my 2 fingers. Okay, grip strength is really good. The muscles overall look really good too. Okay, I'm going to go ahead and have you stand up. And we're going to walk, okay? So if you can start at that wall there and walk normal to me. Okay, gait looks good with the overall walk. Okay, I'm going to have you turn around and walk back on your tiptoes. Gait still looks good, no use of accessory muscles. Now turn and walk back to me on your heels. Okay, that looks really good. Was there any pain at all with any of that? No? Okay, now I'm going to have you stand with your feet together. I don't know if I was in the way. Arms at the side and eyes closed. And I'm going to stand 2 feet in front of you. And this is testing your balance. I don't see any swaying at all. Patient appears to have really good balance. You can go ahead and open your eyes and sit back down. Okay, so gait and balance were good overall. Now we're going to test your range of motion. So I'm going to have you stick out your arms, point up, down, around, out, up, and behind the head. Okay, any stiffness with any of your joints or any pain at all with that, okay? So now we're gonna move on to the leg. So I'm gonna have you stick out this leg, and we're gonna stick it out, and we're gonna point our toes up, down, and move our feet around. Any pain at all with that? Okay, the other leg, we're gonna do the same thing, up, down, move it all around. Any pain associated with that leg?
No.
No? Great, okay. So now I'm gonna go ahead and test your deep tendon reflexes. And so I performed this with the hammer, but we could not find a hammer. So I'm just gonna do it with my fingers and show. So I'm gonna put my thumb here in the crease of the elbow, and I hit here and test for the reflex. I'm gonna test for the reflex here, lower on the forearm. Deep tendon reflexes are good for that arm. We're gonna test here. All looks good for the hand. So now we're gonna move down to the legs, and I'm gonna test the legs here. We're gonna test here. Deep tendon reflex looks good for the legs and for the arms overall. And when I was assessing your mouth and stuff, I would have had you say light, flight, dynamite. Can you repeat that to me now?
Light, flight, dynamite.
So when I was testing that, I would have had her say it so I could check her articulation, and I'd have her remember it for this part of the neurological assessment, but I forgot to do that. But that's how I would have done it. Okay, and then I'm going to test your sensory touch with this cotton swab. I lost my pen. And with my finger. Okay, so I'm going to go ahead and have you close your eyes and tell me where you feel this.
Left arm. Right forearm.
Okay. Now tell me where you feel this.
Left arm. Left leg.
Okay, now tell me where you feel this.
Right arm. Right forearm.
Okay, your sensory input seems really well, and now we're going to move on to your hand and eye coordination. So I need you to put your hands up like this and touch all of your fingers to your thumb and back again. Okay, your hand-eye coordination looks really good overall. Your assessment went really well, and now we're going to run through the cranial nerves, okay? So we're going to go through 1 through 12 and how we would assess them to make sure they're still intact. So cranial nerve 1 is your olfactory. Can you go ahead and smell this? What does it smell like?
Mint.
Mint. Okay, so we would test this by either having you smell mint or coffee. Nothing nauseous at all. Now, cranial nerve 2 is your optic nerve. So I have a piece of paper up here, so I'm going to have you close one eye and read the smallest line that you can.
A, B, C, D.
Okay, now close the other eye and read the smallest line you can.
A, B, C, D.
Okay, that's really good. Okay, so cranial nerve 3 is your ocular motor. Cranial nerve 4 is trochlear, and cranial nerve 6 is abducens. And we test those the same way, and that's going to be with the pen light and your pupil dilation. So look at this shoulder. Now look here. Okay, dilation looks really good in both eyes. Cranial nerve 5 is trigeminal, and we test that with the eye movement test. So I'm going to have you follow my finger once again with only your eyes. Okay, eye movement looks really good for both eyes. That was nerve 6. So now moving on to nerve 7, that is your facial expressions, and it's the facial cranial nerve. So I'm going to have you smile, frown, puff out your cheeks, okay, and close your eyes, and I'm going to apply pressure to your eyelids and try to open them. Okay, good. Cranial nerve 8 is your hearing, and it's your vestibulocochlear, and I'm going to have you close one ear and repeat what I say.
ABC.
Who's the other ear?
Elemental P.
Okay, great. Cranial nerve 9 is glossopharyngeal, and cranial nerve 10 is vagus, and they are also tested together. So I'm going to go ahead and have you say ah, and swallow. Okay, very good. Those are all intact. So that was cranial nerve 9 and 10. 9 was glossopharyngeal, 10 was vagus. Cranial nerve 11 is your accessory nerve. And I'm going to test that by applying pressure when you turn your head and shrug your shoulders. So turn your head to the right, to my hand, to the left, shrug your shoulders. Okay, that nerve is working really good, all intact. And cranial nerve 10 is your hypoglossal, and we test that by having you articulate light, flight, and dynamite.
Light, flight, dynamite.
Okay, all 12 of your cranial nerves are intact. So I go ahead and I document that per my facility's protocols, and I end the assessment.